Hi, I'm Avery Rigney, the Safety Manager with the City of Muskogee. Today we're going to be taking a look at the SOP for pandemic response for our first responders. The purpose of this SOP is to detail all the measures to mitigate exposure to a communicable disease. General precautions include maintaining social distancing when possible, stay 6 feet away from people when possible. If a meeting can be held via Skype, Zoom, or webcam, it should be done that way. No groups of 10 or more. No unnecessary visits to the department locations, such as police stations or fire stations. Avoid unnecessary physical contact. Examples include handshakes, high fives, and hugs. Always practice good hygiene in the workplace. The employer's responsibility. Post signage relating to the pandemic. Have hand sanitizer near all doors and distributed throughout the facility in multiple locations. Frequently disinfect surfaces and provide disinfectant, cleaning supplies, soap and water, etc. to the employees. Employers should ensure that all employees are checked for a fever using a thermometer. This should be done before the shift begins and in a way that minimizes contact with other employees. The employee's responsibility. Be educated on the matter at hand, practice good hand washing habits, wash for at least 20 seconds, use hand sanitizer when returning to the workplace and as needed. Covering your face when sneezing or coughing. If you feel as if you've been exposed or may be sick, stay at home or report your exposure by phone or email to your supervisor. PPE should be worn when coming into contact with members of the public. Inspect PPE for defects often and before every shift. Respiratory protection. A NIOSH 95 or N95 mask should be worn when available. It should be stored in a paper bag when not in use. Do not store in plastic. Do not wipe away or spray any chemical on the mask. It should be worn with a removable, washable cloth cover, and the cloth cover should be washed after each shift. If there is a shortage in masks, any mask is better than none. Gloves. Disposable rubber gloves should be used. After the use of gloves, they should be disposed into a biohazard container if available. If wearing gloves, continue to avoid touching your face because the gloves will still be carrying contaminants. Eye protection. Goggles, wraparound safety glasses, or a face shield should be worn. If wearing a full face respirator with any eye coverings, that will take the place of goggles, wraparound safety glasses, or a face shield. When transporting a suspected infected person, avoid this if possible. If unavoidable, keep as much distance as possible. Wear PPE throughout the entire transport. Have the air conditioner or heater on a non-recirculating setting. Notify the supervisor and your destination that you are transporting an infected patient. Minimize people in the vehicle. Report your possible exposure to your supervisor. Disinfecting the transportation vehicle. Wear all PPE when disinfecting. Use the misting spray following the manufacturer's directions. Do this outside and as far away from buildings and other vehicles as possible. Disinfect thoroughly and often, even when exposures aren't suspected. Disinfect any reusable equipment that was in the vehicle. Examples, handcuffs, walkie-talkies. Disinfecting your gear. Employees entering the facility coming to the start of their shift should disinfect their hands and shoes prior to entry. Apply hand sanitizer or wash hands. Spray shoes with a disinfectant spray or wipe them with a rag containing a disinfectant. Examples include Lysol or Germ-X. Each facility will have their own protocol due to different gear. Gear should be disinfected before every shift and after each medical run. Be thorough and sanitize your hands after removing PPE. For the latest information and best practices for each type of PPE or gear, view the link below. Disinfecting a facility. Facilities that do not house people overnight. Wear all PPE when disinfecting. Close off areas visited by ill persons. Open outside doors and windows and use ventilating fans to increase air circulation in the area. Wait 24 hours or as long as practical before beginning cleaning and disinfection. Cleaning staff should clean and disinfect all areas such as offices, bathrooms, common areas, share electronic equipment like tablets, touchscreens, and keyboards, remote controls, and ATM machines used by the ill person, focusing especially on frequently touched surfaces. Facilities that do house people overnight. Wear all PPE when disinfecting. Follow the interim guidance for the U.S. institutions of higher education on working with state and local health officials to isolate ill persons and provide temporary housing if needed. Follow the link below. Close off areas visited by the ill persons, open outside doors and windows, and use ventilating fans to increase air circulation in the area. Wait 24 hours or as long as practical before cleaning or disinfection. In areas where ill persons are being housed in isolation, follow the interim guidelines for the environmental cleaning and disinfection for U.S. households with suspected or confirmed coronavirus disease. The link is below. This includes focusing on cleaning and disinfecting common areas where staff and others providing services may come into contact with ill persons, but reducing cleaning and disinfection of bedrooms and bathrooms used by ill persons as needed. In areas where ill persons have visited, continue routine cleaning and disinfection as in this guidance. Fire departments should thoroughly disinfect beds and bedrooms between shifts, including all hard surfaces, as well as changing sheets and pillows. Document and report any exposures, possible exposures, cleaning and disinfecting, contact with the public when not wearing PPE, and transportations of suspected persons. Always follow all general bloodborne pathogen universal precautions. And if an employee becomes symptomatic, follow these steps. Personnel who become symptomatic should immediately be taken off duty, screened by a healthcare provider, and tested for COVID-19 if available. If the test is positive or not conducted, personnel should follow the CDC and Oklahoma State Department of Health quarantine guidelines. The Oklahoma State Department of Health quarantine guidelines include staying at home, avoiding public areas, staying away from others, limit contact with pets and animals, call your doctor, alert the health department, and do not leave your home until instructed by a healthcare provider. Approval to return to work would be determined by the individual department utilizing the OSDH acute disease and CDC guidelines. A test-based strategy. When following a test-based strategy, exclude from work until resolution of fever without using fever-reducing medications, improvement in respiratory symptoms, examples include cough and shortness of breath, negative results for an FDA emergency authorized molecular assay for COVID-19 from at least 2 consecutive swab specimens collected less than 24 hours apart. Non-test-based strategies. Exclude from work until at least 3 days have passed since recovery defined as a resolution of fever without fever-reducing medications and improved respiratory symptoms. At least 7 days have passed since symptoms have first appeared. If first responders were never tested for COVID-19 but have an alternate diagnosis, example, tested positive for influenza, criteria to return to work should be based on that diagnosis. Return to work practice and work restrictions. Wear a face mask at all times until the symptoms are completely resolved or 14 days after the onset of the illness, whichever is longer. Be restricted from contact with severely immunocompromised employees until 14 days after the onset of the illness. Adhere to hand hygiene, respiratory hygiene, and cough etiquette in the CDC's interim infection control guidance. Example, cover nose and mouth when sneezing and coughing, and disposing of tissues and waste receptacles. Self-monitor for symptoms and reevaluate from occupational health if reevaluation from occupational health if respiratory symptoms reoccur or worsen. If you have been exposed or possibly exposed, see sections 2.3.6 through 2.3.6.4. Thank you, stay safe and healthy.